Welcome. Now, a patient may come back to you after using CPAP complaining of eye irritation, a disturbed spouse, multiple awakenings at night, or even dry mouth, and this may be a clue to mask leak occurring during the night. Now, it's important to assess the amount of leak as well. One thing you can do is look at the compliance report. Now, the compliance report states that there's a leak of more than 30 liters a minute and at least a 95th percentile. That should indicate that this is a significant leak. However, the amount of leak may also be misleading, and some patients may just wake up due to a small number of leaks which are significant as opposed to a large quantity of leak. So it's important to verify that if possible, but if not, then trust the patient's history as well. Mask type is important to address due to mouth dryness or even air leak due to the possibility of their mouth breathing. For example, if a patient is on nasal mask or a nasal pillow, a mouth breather in these situations may cause significant air leak as they open up their mouths to breathe, causing significant dehumidified air to escape through the mouth, causing significant mouth dryness. Now, it's important to consider if the patient would even want to switch masks to a full face mask, which would be the solution. If they're pretty adamant on using a nasal mask or nasal pillow, then a chin strap may be a significant solution for them. The next thing is to consider the location of the leak. Now, the location of the leak is around the eyes, for example. A gauze may help plug up some of the leak which is applied to the nasal bridge. Different kinds of masks as well, even mask types, for example, even if they're using a full face mask. Not all full face masks are built the same. Different masks may adapt to different facial structures, hence plugging up the possible leak that irritates their eyes. So that's something to consider. So the location of the leak, especially if it's in the eyes, it may change the way you address the issue. The age and care as well is important of the mask. Now, as the patient uses the mask on a daily basis, the mask or the lining, which is the rubber structure on the face itself, may weaken and slip and slide as pressure changes occur with an auto-PAP machine or even positional changes, causing the patient to wake up repeatedly due to mask leak, as the mask doesn't adhere to the face as well as it did initially when it was first received by the patient. So as the mask gets older, it's important to keep the mask clean and the lining clean as well, and this can be achieved with using some warm water and a little bit of soap, and should be cleaned more frequently as the mask ages. Now, most insurances should allow for the lining to be changed every 2 to 3 months, and this should be kept up to, especially if the patient experiences mask leak that becomes more significant as the mask and lining gets older. Straps as well will get older. As the straps get older, because of tightening of the straps over a period of few months, they may cause it to loosen and significantly cause leaks as well in these masks that don't adhere as well to the face. Facial hair is an issue in some patients with significant amount of facial hair, or as they grow facial hair as they use the mask. The facial hair won't allow the mask to adhere as well to the face, causing significant air leaks, and that should be addressed with the patient. If this all fails, a PAP nap has been found to be extremely useful. A PAP nap occurs usually at the sleep center itself, where the patient, after starting on CPAP, may go back in, try different masks on, and attempt to lay down flat in a similar manner at home, and the respiratory tech will work with the patient to address any issues regarding leak and mask fitness and comfort with these patients. So those are the options available to patients, especially with mask leak on CPAP. Thank you.